Hi everyone, welcome to our channel Canadian Nurse Expert. Today's topic is Amyotrophic Lateral Sclerosis, or ALS. ALS is a serious neurological disease that affects thousands of people worldwide. It is a condition that progressively damages the nerve cells in the brain and spinal cord. It is also known as Lou Gehrig's disease, named after a famous baseball player who had ALS. Lou Gehrig brought national attention to this debilitating condition when he was diagnosed in the 1930s. This disease affects the nerve cells that control voluntary muscle movements, which are the movements we consciously control. These movements include actions like walking, talking, and swallowing. As the disease progresses, these everyday activities become increasingly difficult. ALS is a progressive disease, meaning that it gets worse over time. The rate of progression can vary from person to person, but it ultimately leads to severe physical limitations. Currently, there is no cure for ALS. Research is ongoing, but the complexity of the disease makes finding a cure challenging. However, there are treatments available that can help manage symptoms. These treatments aim to slow the progression of the disease and improve the quality of life for patients. These treatments can help manage symptoms and improve the quality of life for those living with the disease. Support from healthcare professionals and loved ones is crucial. Understanding ALS is the first step towards raising awareness and finding effective treatments. Public education and research funding are essential in this fight. This essay will provide a comprehensive overview of ALS, delving into the intricacies of the disease. We will discuss its causes, symptoms, diagnosis, and treatment options. Each aspect is critical to understanding the full impact of ALS. We will also explore the importance of emotional support and research in the fight against this devastating disease. Together, we can make strides towards better treatments and hopefully, a cure. To understand ALS, it's crucial to grasp how it affects the nervous system. The nervous system is like our body's internal communication network. It is made up of the brain, the spinal cord, and nerves that branch out to all parts of the body. Motor neurons are specialized nerve cells. They transmit signals from the brain and spinal cord to our muscles. These signals tell our muscles to move. In ALS, these motor neurons are gradually destroyed. Imagine a wire with fraying ends. The signal can't get through properly. As motor neurons degenerate, the muscles they control become weak and eventually stop working altogether. The early symptoms of ALS can be subtle. They often start with muscle weakness in a limb, like a hand or foot. This weakness might make it difficult to perform everyday tasks. Examples include buttoning a shirt or writing with a pen. As the disease progresses, the weakness spreads to other parts of the body. Muscles may begin to twitch involuntarily, a phenomenon known as fasciculations. Over time, ALS affects muscles involved in essential functions like speaking, swallowing, and breathing. Speech may become slurred and swallowing can become difficult. In later stages, breathing difficulties may arise, requiring assistance from a ventilator. The exact causes of ALS remain largely unknown. However, scientists believe that a combination of genetic and environmental factors is likely involved. In about 5 to 10% of cases, ALS is inherited, known as familial ALS. This means that the disease runs in families. In these cases, mutations in specific genes have been identified. These mutations are passed down from parents to their children. The majority of ALS cases, however, are sporadic. This means they occur randomly, with no clear family history. The cause of sporadic ALS is still being investigated. Researchers are exploring potential triggers, including environmental toxins, viral infections, and immune system abnormalities. While anyone can develop ALS, certain factors may slightly increase the risk. Age is one of those factors. The risk of ALS increases with age, with the most common age of diagnosis being between 55 and 75. Gender also plays a role. Men are slightly more likely to develop ALS than women. Genetics is another factor. Having a family history of ALS increases the risk. Interestingly, military service has been linked to a slightly higher incidence of ALS. Studies have shown that veterans are at a higher risk. It's important to note that these are just risk factors, and having one or more doesn't guarantee that a person will develop ALS. Further research is needed to fully understand the complex interplay of factors that contribute to the disease. Diagnosing ALS can be challenging, as its early symptoms can mimic other neurological conditions. There is no single test to definitively diagnose ALS. Instead, doctors rely on a combination of medical history and physical exam. Doctors will ask about symptoms, family history, and conduct a thorough physical examination. Neurological examinations. These assessments evaluate muscle strength, reflexes, coordination, and sensation. Electromyography, EMG, and nerve conduction studies. These tests measure the electrical activity of muscles and nerves, helping to identify any abnormalities. Magnetic resonance imaging, MRI. This imaging technique creates detailed pictures of the brain and spinal cord, ruling out other conditions. The diagnostic process may take time and involve consultations with various specialists, including neurologists, physiatrists, and pulmonologists. While there is currently no cure for ALS, there are FDA-approved medications that can slow disease progression and manage symptoms. These medications offer hope and can make a significant difference in the lives of those affected by ALS. Riluzole. This medication is thought to work by reducing the levels of a chemical messenger in the brain called glutamate. Glutamate is believed to contribute to the nerve damage seen in ALS. It has been shown to modestly extend survival, giving patients and their families more precious time together. Edaravone. This drug works by reducing oxidative stress, which is thought to damage nerve cells. By mitigating this stress, edaravone aims to protect the neurons and slow the disease's progression. It may help slow the decline in daily functioning for some individuals, allowing them to maintain their independence for a longer period. In addition to medication, a multifaceted approach to symptom management is crucial for improving quality of life. This approach often involves a team of healthcare professionals working together. Physical therapy. This helps maintain muscle strength, flexibility, and range of motion. Regular physical therapy can also help reduce pain and discomfort. Occupational therapy. This focuses on adapting daily activities and using assistive devices to promote independence. It helps patients find new ways to perform tasks that have become challenging. Speech therapy. This assists with communication and swallowing difficulties. Effective speech therapy can significantly improve a patient's ability to communicate and eat safely. Nutritional support. As swallowing becomes difficult, maintaining adequate nutrition often requires modifications to diet or the use of feeding tubes. Proper nutrition is essential for overall health and energy. Respiratory support. In later stages, breathing assistance with devices like ventilators may be necessary. This support can greatly enhance comfort and prolong life. Managing ALS requires a comprehensive, multidisciplinary approach. This means that a team of healthcare professionals works together to address the individual needs of each patient. This team may include neurologists, specializing in nervous system disorders. They lead the diagnosis and management of ALS. Physiatrists. These doctors focus on rehabilitation and improving physical function. Pulmonologists, lung specialists who manage breathing difficulties. Nurses provide ongoing care, medication management, and education. Social workers offer counseling, connect patients and families with resources, and provide emotional support. Dietitians help manage nutritional needs and swallowing difficulties. Speech-language pathologists address communication and swallowing challenges. This collaborative approach ensures that all aspects of the disease are addressed, promoting optimal well-being for those living with ALS. Receiving an ALS diagnosis can be overwhelming for both patients and their families. The initial shock and uncertainty can be paralyzing, leaving many feeling lost and unsure of what steps to take next. It is a life-altering condition that presents physical, emotional, and practical challenges. From navigating complex medical systems to managing daily care, the journey can be daunting. However, it's essential to remember that there is hope, and there are many ways to maintain quality of life and find support. Building a network of care and leaning on community resources can make a significant difference. Emotional support. Connecting with loved ones, support groups, therapists, or spiritual advisors can provide invaluable emotional support. Sharing experiences and feelings with others who understand can be incredibly healing. Advanced care planning. Discussing end-of-life care preferences with loved ones and healthcare providers ensures their wishes are respected. This proactive approach can bring peace of mind and clarity during difficult times. Clinical trials. Participating in research studies offers hope for finding new treatments and a cure. Engaging in these trials not only contributes to scientific progress, but also provides patients with access to cutting-edge therapies. Assistive technology. Utilizing assistive devices like wheelchairs, communication boards, and home modifications can promote independence and enhance quality of life. These tools empower patients to maintain their autonomy and engage more fully in daily activities. While ALS presents significant challenges, advances in research and care are offering new possibilities for treatment and hope for the future. The dedication of scientists and healthcare professionals is paving the way for breakthroughs that were once thought impossible. By raising awareness, supporting research efforts, and providing compassionate care, we can make a difference in the lives of those affected by this devastating disease. Together, we can foster a community of hope and resilience, ensuring that no one faces this journey alone.